Hi, my name is Sarah, and I'm one of the educators in the clinical education department.
My name's Kelly. I'm one of the unit-based educators here at the infirmary. And we're going to start doing a bedside shift report. This is one of the Studer forms. You should have this in your packet. And this is what the nurses here use to do their bedside shift report.
So it's always important to knock and gain entry into the patient's room. So we're going to be going into his room.
Let's come in.
And always wash your hands when entering a patient's room.
So this is Mr. Smith.
Hello.
Let's check his ID band.
Okay.
Looks like his band has come off, so I need to go get a new band for you.
Okay.
Can you tell me your name? This is Mr. Smith. Okay.
Yes, very good.
All right, so this is going to be Sarah. She's going to be your nurse for this next shift.
Hi.
And she's an excellent nurse. So just give us a few minutes to go over your bedside shift report, and so I can tell her about your care. Okay.
Great.
All right, so Sarah, he was admitted with a motor vehicle accident.
Okay.
And he has the chest tube inserted. He has a history of diabetes.
Okay.
He's alert and oriented ×4.
Great.
He has the nasal cannula. His pulse ox was running about 95 since we've got the nasal cannula on. He's up to 98% now, so we'll probably get the nasal cannula off later today.
Okay, great.
He does have a Foley in place. And
Okay.
it's hanging over here on the side of the bed.
Yeah. Let's take a look at
Let's
that.
see. I didn't get the clip in place.
Okay.
That's very important to prevent those dependent loops.
Sure. That looks like it's hanging on the bed, lower than the bladder.
Yes.
And has it recently been emptied?
Yes.
Okay.
The PCT did an excellent job emptying that for me.
Okay, wonderful.
He is a fall risk. He has on his yellow footies,
Okay.
his yellow socks to indicate that. And he was a fall risk only because of the motor vehicle accident. He's not fallen.
Okay, wonderful.
All right, he does have an IV. They started it right here on this side of the arm.
Okay.
And it looks like we left the tourniquet on. We better take that
Goodness.
off.
Yeah. We'll take
All right,
this tourniquet
we'll get
off
rid of that.
and assess his arm to see if he's having any circulation impairment.
And then you can see he has on a wrist restraint.
Yes.
Okay. Oh, well, Sarah, I think I had some difficulty putting that on. Does that look okay to you?
Yeah, let's discuss this, Kelly.
Okay.
So we want to have the restraint secured to an immovable part of the bed. And right now it's attached to the side rail. And so if I were to lower the side rail, that could pull on Mr. Smith's arm. So that could be a safety concern.
Okay.
So that's simple, we can adjust that. And I'll quickly show how to apply and remove.
Okay.
So since it's already applied, to remove it, it's very simple. We don't have the old-fashioned where you have to tie the sailor knots anymore, which is really great. You just release the buckle, and that
Okay.
will release the patient from the restraint. So there's two parts to the restraint. This part goes around the immovable part of the bed, and it just loops through like so. And then the other part goes around the patient's wrist. And I guess I'll go ahead and unclamp this and show. So you have this inner part, which is soft and cushioned to provide comfort for the patient, that goes against their skin. You want it to be tight, but not so tight that it cuts off circulation.
That looks much better.
Okay, and then we will secure the buckle. And then we would attach the buckle back to this portion that is secured to an immovable part of the bed, like so.
Okay, thank you for helping me with that.
Yeah, of course, Kelly, anything.
Okay.
Anything else going on with Mr. Smith that we need to look at? This dressing has a lot of drainage on it.
It does. I had a really busy night.
Okay.
So a preceptor said something about, I can't remember, date and initial it, or date, initial, and time it, something. And I didn't have time to do that. Will you help me with that too, Sarah?
Yeah, of course. It's always great to label your dressings with a date and initial and time. That way when other staff members come and assess the patient, maybe even the physician, they can know when the dressing was applied.
Okay, thank you. I'll make a note of that.
Sure. Anything else with Mr. Smith's condition? Any allergies or anything?
No, he doesn't have any allergies.
Okay.
He doesn't have any drug allergies, no food allergies.
What is that box on the table, Kelly? Can you explain that?
Yes, this is his personal belonging box, and it is supposed to have items that belong to him, and then we
Okay.
can put it close to his bedside table. So we can put his cell phone, his charging cord, if he has some hearing aids, anything personal. But you know, one of the nurses said it's really handy to put things that they use in there, but it clearly says personal belonging tray, so it's for the patient.
Okay, great. Well, we can dispose
Okay,
of those
I'll-
nursing supplies.
All right, I'll do that. I'll do
And then
that.
we can have that for Mr. Smith's personal belongings. It's a great way to keep up with them.
Yes, yes.
All right. Let's see, is there anything else that we need to discuss?
He has the menu here so that
Okay.
he can order his breakfast.
Great.
He's not going for any test,
Okay.
so he can order. He's been instructed on how to call and place an order.
Is he
He's got
on a
his-
regular diet?
Yes, he's
Okay.
a regular diet.
Great.
And he's got his water pitcher here.
Okay.
So,
Mr. Smith, do you have your call light where you can call me if you need anything? We want you to be
it's
safe.
actually right here by his hand.
Oh, great.
And he's been oriented to the room. He's got both side rails up for his safety, for his protection. And that's what he's requested.
Okay.
So I think that's it. I'll take care of this. Is there anything else I can help you with before I leave? And then Mr. Smith, I'm gonna be off the next, Sarah's gonna be here, and then I'm not gonna work tomorrow, okay?
Okay. Yeah,
So,
well, I'll see you in a couple of days.
Is there anything we need to do for you right now? Anything we need to add? Anything you wanna comment on?
Well, Mr. Smith, I'll be back in about an hour. Of course, if you need something before then, please push your call button, okay?
All right, thank you for letting me take care of you. I appreciate that.